someday.
You never know.
And a bike path over that road. So,
That's all being discussed.
I would love it.
All right, we're about a minute out. Excuse me.
Mom seems to be doing it. I mean, she is just meticulously determined. She's out watering her crops.
That's her therapy. She talks to her plants and
I think that's so
she plays
cool.
bridge
I've
4 days a
heard
week.
that.
Yeah, and she still tells me. Morning. Are you awake? All right. Well, let's get started. It's 8:30, and I'd like to welcome everyone to our weekly press briefing here in the last few weeks. We're joined today by Kirk Carlson from Bowen Center, our testing consultant and mental health consultant as well, if you will. Certainly Dr. Remington from the health department is providing all the scientific basis for a lot of what we do as far as facts. And then I know Bob Weaver and Teresa and Jeannie out at the shot clinic are ordering supplies, getting clinics running, getting testing, keeping testing going. So obviously a huge part of what we're doing is from the health department, and we're happy to have Dr. Remington here. So with that, I think I'm going to turn it directly over to Dr. Remington to get us started this morning, and then we'll bounce around here.
Well, thank you again, Mayor, for inviting the health department. Let me just give a quick briefing here, cases for our county, vaccination stats, and then some emerging topics. So our cases, again, are up, 300 some cases. We crossed the 11,000 threshold a week ago. We're at 11,345 now. We have an additional death from last week. We remain in the orange advisory from the State Department of Health. We were there. We've been there now for several weeks. We're at 12.8% positivity, down a little bit from 13.3% a week ago. The state watches that positivity trend closely as they pick that color advisory for our county. We're averaging about 34 new cases daily. We were at 27 a week ago, 134 at our worst in November. Another key metric is the number of weekly cases per 100,000 population. We're at 387 now. We were at 390 a week ago. Indiana hospitalizations are at just below 2,500. We were close to 2,700 a week ago. At our worst, about 3,500 in December. Indiana deaths, 7-day moving average, is down just a little bit from a week ago, from 23 to 20. At our worst, in November, we were at 100. The vaccination stats across the state are about the same as they were a week ago, 6.4 million doses, 3.2 million Hoosiers fully immunized that are age eligible. Kosciuszko County, we're getting closer to 29,000 residents fully immunized. That's 43% of eligible Kosciuszko County residents. So that's up 430 some doses from a week ago. And we're up just a tick in percentage from 42% to 43%, as I mentioned. So cases, just a little bit softer. Vaccination stats kind of static, although maybe, again, 400 extra people in our county fully immunized, I think, is good. We were 300 some more from the previous 7-day intervals. So a few more people coming in for immunizations. Kudos to my health department staff, Warsaw Wayne Fire, Bowen Center, and coordinating another mobile vaccination site at Our Lady of Guadalupe Church this week. Another hot weekend vaccination clinic. I think 160 some people immunized with that venue. So thank you to all of those people who took a hot Saturday morning to do that. I'm very proud of my health department staff in general, but particularly in today's briefing, just a kudos to Jeannie DeWild and her staff doing immunizations. We still depend on many volunteers, and so thank you for those, some of them who've done this for months now, volunteering their time, registered nurses largely. It's just humbling to me to see that. On the emerging bullet points I have, a sobering milestone that perhaps you've heard quoted, the 1918-1919 Spanish flu claimed 675,000 Americans, they believe. We crossed that threshold of U.S. deaths in the last couple days. Rather sobering. Of course, the population of the states now is much different than it was a century ago, but still a sobering milestone. Indiana hospitalizations, on a positive note, are a little softer this week. September 16th, they were under 2,600 total admissions for COVID across the state. And I think that was 7 days in a row, the first that's been seen since June. So hooray, right? That's a little bit softer, just a little bit. I know locally, our local hospital continues to feel a lot of heat from a high census of inpatients, many of them related to COVID. So the so-called disease burden and local transmission remains very high in Kosciuszko County. We need layered mitigation, all those things we've been saying, immunizations, masking, social distancing, good hand washing, avoiding crowded venues, particularly indoor venues, rethinking how you frame up an indoor gathering if you are an event planner. All of that makes a difference. And perhaps most of all, as I was reminded by our communicable disease nurse, Teresa Reed, this morning, stay at home if ill. Please, please, if you're coughing, feel achy, run down, don't go to work, don't go to school. Seek a test. There's a high likelihood that it could be COVID. Again, most people will not have serious, horrible experiences. Some will. We are not seeing influenza yet, so those symptoms are likely to be some other viral pathogen other than influenza. And COVID, with the local transmission, statewide transmission that we're seeing, remains high on my list as a clinician as I hear a patient describe those symptoms. So please stay home and get a little more information, get a test. Schools remain a hot topic, to say the least. I am fully supportive of the governor's executive order of September 1st, which I believe was brilliant. It wisely reframed quarantining within schools, a real olive branch to them. Schools, to recall, in early September were quickly being decimated by sick kids and staff, and if you were serious about quarantining, you just took out lots of people. It became quickly very difficult to run business as usual. Had a couple schools in our county that went virtual for a brief period of time, and it looked as we heard guidance from the state, that the worst was yet to come. So at that pace, we were, I think, heading toward losing the ability to pull off successful in-person schooling if something didn't happen. So that executive order by the governor was all about keeping kids in school. Not virtually, but in person. I think we all desire that. That's what that all was about. It's too early to come off our quarantine directive, not with the disease burden and very high transmission rates that we're seeing. It just isn't the time. So until that time changes, we have to do these things like quarantining and closing down venues occasionally. None of us like it. So masking makes a difference. Good data, again, great science from the state of North Carolina and others, even some internal work by the State Department of Health showing that if you wear a mask, universal masking in schools, you stay in school. Quarantining can be looked at differently. You don't decimate families, sending people home for large periods of time who are not ill. because of a quarantine directive if everybody is masked. And I'll just tell you, that is such a game changer. And just anecdotally in conversations we've had with our one local school that's been brave enough to do that, it's so much easier on them. It's horrible in transition, no doubt about it, all the angry voices, and I think people just not quite understanding what this is all about. Once you get past that, you settle. It's so much easier. Kids are in school. You don't have as empty a classrooms. There isn't such a hype for testing of asymptomatic people, which I think we appreciate in this community. So, wear a mask, stay in school. The governor's executive order of September 1st was wisely crafted. Vaccines are still the most effective mitigation step. We will get through this pandemic one way or the other. Eventually, the population is wiser to this pathogen. There is immunity. One way or the other, it softens. Pandemics go away. This one will go away. But we have a real tool, and the best tool we have right now is greatly crafted vaccine strategy. These are not rogue vaccines. They have been carefully thought through. Breakthrough cases do occur. They are less than 5% of all hospitalized COVID patients. So vaccination uncouples disease burden from cases. It, as you might have heard others say, it defangs it. And that's what we want. Doesn't eliminate it, but it defangs it. Those who are immunocompromised, and there's quite a list of who would be included in that, should get a third dose of a messenger RNA vaccine now. Booster guidance is very soon to be publicly presented by the CDC. I believe the Advisory Committee on Immunization Practice is meeting today and I believe tomorrow. It looks like the booster guidance will be offered to those 65 and older and some other high-risk patients. That is a separate group than the immunocompromised group that I've mentioned previously. So stay tuned to that. It's just be a few days. We'll hear what that guidance will be, and I encourage consideration to that. There's been a little debate about the booster need. I don't think there's any concerns that it's unsafe. That's not the topic. The topic is, in the context of being a good global citizen, is the case super strong that we should be taking doses of vaccine to offer third doses in this country where so many countries are still struggling to get a first dose? I don't know that I can answer that. But that third dose really does seem to boost antibody levels. There's some really good data, particularly out of Israel, who has seen some breakthrough cases despite a highly immunized population. Boy, you give them that third dose and hospitalizations quickly drop off again. So really good data. That third dose offers real protection. Real protection. So please consider that booster when that guidance comes. The other emerging topic with vaccines is younger children. Pfizer offered some data to a committee looking at 5 to 11-year-old children being immunized with a lower dose Pfizer vaccine. Good data as far as safety and efficacy as far as antibody levels. That dose is a third of the adult dose we're using now. So if that all trickles through the advisory committees and the FDA and the CDC, we may see Pfizer vaccine available for younger children in October. That'll be something to watch. At the Health Department, we continue to offer COVID immunization Monday, Wednesday, and Fridays from 8:30 to 10 o'clock, and we're nimble on top of that. And especially with the booster surge, which we may sense coming to us at the Health Department, we will expand as we feel we need to. Again, thanks to all the staff who's willing to do that. We have all 3 vaccines that are FDA approved at the Health Department. Patients may choose which one they want. It looks like the messenger, I brought an article from the CDC, the Morbidity and Mortality Weekly Report of September 17th actually compared effectiveness of Moderna, Pfizer, and Janssen, the Johnson & Johnson vaccine, in preventing COVID hospitalizations. And the narrow winner was Moderna over Pfizer, both a step above the J&J vaccine in preventing hospitalization. So the messenger RNA vaccines seem to be working a little bit better, particularly in the face of Delta. But really, any of the three are great options. But that publication may be of interest to some of you. Go to rshot.in.gov or call 211 or go to your pharmacy. Walk-ups are usually okay at any of those venues, our health department venue or a pharmacy. Calling ahead, making an appointment always helps. Please be immunized. Thank you, Mayor.
All right, thanks, Dr. Remington. And again, just for clarification, the state updates their website at noon on Wednesdays, and currently we are orange, and we will be staying at orange as of noon today. So if you jump on the site now, it actually is for up through today. After 12 o'clock, when it's updated, that means that we continue to be at orange for the next week. So also, I heard something this morning about the J&J second dose booster shot, that some of the early numbers on that, or it takes it up to like 94% as well. So I didn't want to leave J&J out of the mix.
That's good. No, I hadn't heard that. I'm sure that a booster would have great application with that vaccine. Yeah.
Okay. All right. Thank you. All right. Kirk Carlson, Bowen Center. I know you've been doing a lot of work out at the fairgrounds with testing. You're up.
Okay, thank you, Mayor. Thanks for the opportunity. Yeah, we are down from our high point of 200 a day. We leveled off for a while at 160 a day on the average, and we're now down to about 120 a day. We're fully staffed. Got all the people in who we were hiring. I actually brought one person back who had moved on in their career and wanted to come back to the test site. And looking at the two pieces of data that Bob Weaver asked us to start keeping here recently, which we did not keep before, and that's how many people were symptomatic. And when we started keeping this data earlier on during this surge, most of the people were asymptomatic. That has flipped. So now approximately 2/3 of everybody coming to the test site are reporting symptoms. And that's exactly the opposite of what we were experiencing earlier on. And we also started more recently collecting positivity of the tests, because when we were doing the deep nasal pharynge, those would go to the state and we would not get those results back. But now when we're doing mostly rapid tests, we have those results there, and it's averaging between 1/3 and 1/5 of the people, depending on the day, are testing positive. And so I don't have any comparison to the past, because in the past we used the other tests that would take longer to get the results back. So we'll be tracking that into the future. I think with schools not having to do as much, required to do as much testing of the kids to be in school, I believe the age has dropped off. The younger children numbers have dropped off a bit. And so now it's that 21 through 30, I think, is the highest percentage of people coming to the test site. Did hear from Dr. Weaver. She is with the State Health Department. There are some hospitals, she's an ER physician herself, and she was reporting that some hospitals in the state are so overwhelmed that she's actually considering doing what some states have done, and that's bring in the National Guard. And I've not heard anything like that locally, but it varies depending on where you are in the state and how stressed some hospital systems are. I think that's about all I have, Mayor.
All right, thank you, thank you. So again, I wanted to thank Health Department and our Warsaw Wayne Township Fire Territory for their help with the Our Lady Guadalupe Clinic this past week. On Saturday, second shots and some first shots were given, so That's good news. If any organization or company or industry wants to have a mobile clinic, please contact Bob Weaver at the Health Department and/or our fire territory, and we'll be glad to set that up. Kind of along that lines, I was able to look at some information that was just provided yesterday from the state. So these are all state numbers, and it really points to the importance of being vaccinated. Breakthrough cases, and this is since January 18th, are about 1% of fully vaccinated individuals. So 1% of those that have had full vaccination will probably experience or could experience a breakthrough case. And that accounts for about 10% of the total cases since January 2018. Again, this is Department of Health information. What really struck me, again, about the importance of vaccination was just information from the week of September 5th. Kind of go along with Dr. Remington said, did some quick math, and of all the new hospital admissions, 1.1% of those folks were fully vaccinated. So it's a very, very small number. If you're fully vaccinated, your chance of going into the hospital, of those going into the hospital, only 1.1% of those new admissions were fully vaccinated. Slightly higher going into ICU. If you're fully vaccinated, you account for just about 2% of those that are admitted to ICU. Deaths is under 1%. So under 1% of the deaths of September 5th, 2021, as reported by the Indiana Department of Health, were in fully vaccinated individuals. So, those are just, to me, such compelling reasons to be vaccinated. Again, we've talked about safety, efficacy, availability, and here are basically the tangible results. If you get a COVID vaccination, there's a chance you can get COVID, and we all know that. But these hospitalizations, ICU admissions, and deaths are just infinitesimally smaller if you've had that vaccination. So certainly, again, appreciate the work being done locally to get these vaccinations continued. I would just, again, if you have the desire or need for a mobile clinic, please call Bob Weaver at the Health Department and/or Fire Territory. We can handle setting those up. Also, help me, Dr. Remington, I think Monday, Wednesday, Friday, 8:30 to 10:30, as you mentioned, is the shot clinic. Encourage registering, but walk-ups are welcome. I'm a little encouraged that it seems like there is I'm a little bit more optimistic. I think there's a little slight uptick in the number of those seeking vaccinations now here locally. We just need to keep it up. So I guess that's my message today. We've got a few questions from our Facebook audience, and I'll read those, and I believe, Dr. Remington, they're directed potentially at you. The first question is, excuse me, says, for parents, as we go into fall with RSV, flu, etc., also going around, what should our strategies be, especially with children?
Well, keep sick kids home. You're right, it'll become more confusing as to what exactly the pathogen may be, provoking that clinical scenario when we get deeper into winter. RSV typically really kicks up closer to January, influenza after Thanksgiving. So come December and January, this becomes rough to perfectly sort out. So it'll settle out to simply keeping a sick child home. All of these pathogens in a child are not typically going to end up in a horrible case. Children will be resilient to all three of those pathogens. Stay tuned to immunization guidance for COVID, seek flu shots for children. We don't have a vaccine for RSV, but it's a great question. So, just be an attentive, insightful parent, and seek testing perhaps more than we usually verbalize through respiratory season. Testing will have its place through this upcoming respiratory season. And I wish that was a little bit easier for people to get to. We have a wonderful asset with the Bowen testing site. which is drive up. Offices offer it, including my personal office. We are doing in-office tests now. So it's easier, but still, getting out and getting a test is kind of tough. In-home testing has a place. We're in a framework currently with school children in the state of Indiana where that test result really doesn't come to play as far as formal guidance with isolation and quarantine. And that's from the framework handed us by the State Department of Health. So even though I think a rapid in-home test can inform you as a parent, realize this, that with rapid tests, false negatives may or may not help you, really. It's a piece of information. Or a negative test result may or may not help you. False negatives are a real issue with rapid tests. So you just take it in context of folding into your calculus as a parent as to how to think through when your child is ill. Seek medical care specifically if that child is very ill appearing, of course. Most children with all three of those pathogens, to say it again, will not become critically ill and will not need hospitalization.
So, and again, I think this question kind of brings up those at home who all of a sudden wake up with a symptom, or their children have a symptom. And with all these different viruses, seasonal viruses going around, I know this is a difficult question, but at what point do you decide maybe I should go get a COVID test?
So I think you could, again, depending on the circumstance and your exposure risk, knowing if you've been in close contact with somebody, you could give it 24 hours, let's say. Build some judgment. There's nothing wrong with running right out and getting a test, don't take me wrong, but if that doesn't sound super good to you, then fine. I mean, the main thing is to just hunker down at home, isolate. I think it's tough. Okay, say it's Johnny or Susie ill, day number 1 with a cough and cold. Should mom or dad go off to work? Well, someone needs to stay home with Johnny or Susie, number 1, right? If your risk calculus is not super high, in your opinion, for COVID, I don't know that I would, and let's say parents are immunized, this makes it easier, then I would say you go to work. You don't quarantine as an asymptomatic contact. Number 1, you don't even know that you're a close contact because you don't have a confirmed case in your household. That's, again, to put a plug in for immunization. Immunizing those that can be in that household helps soften this. It really does. So you can get off to work and not feel too awful about you being a potential contact to somebody at work. If you're not ill, you're not even sure what Johnny or Susie has yet, and it's just been 24 hours and they're mildly ill. You're immunized. I'd go to work. I mean, wear a mask if it's a masked environment for sure. Like in healthcare, that's what we do. And this happens all the time with healthcare workers. You wear a mask, you go to work. If Johnny or Susie test positive, then you need to think through that differently and contact supervisors and all that. You're right, this is tough. And I think it's particularly tough as it interfaces employment and bringing a paycheck home to the family. These are real issues. That's why I was hoping back in late May and June when the whole thing was softening that we could kind of chill out on these public health endeavors. But as you know, this surge has had fangs to it, to use that word again, with hospitalizations, disease burden, and we're just not there yet. We just can't perfectly let off these public health things that we say to do. Yeah.
All right, thank you. I know there's not an easy answer to that question.
Yeah, that's tough. There's a real calculus to think through, I think, for each family.
Another question, and I assume they're asking, says, are doctors in our county prescribing therapeutics for COVID patients? I assume that's outside of hospital care. So if someone has a COVID case and comes into your office, are you able to prescribe those types of medicines?
That's a great topic. There are all kinds of things thrown around by providers, and each one of us will have a different take on the literature. In my opinion, there's not huge support for a lot of things that are thrown around, the vitamins, vitamin D, zinc, Pepcid, all that. I think the evidence is really soft on all that. If you have COVID and you are a high-risk scenario, we should try to get you to a monoclonal antibody infusion as an outpatient. That's the main thing therapeutically to offer. If someone's sick enough to be hospitalized, there are other therapeutics to offer them.
And one final question from our social media audience. If you get COVID and are symptomatic, what can you do for self-care to keep yourself out of the hospital?
Yeah, I think one of my favorite pieces to share with my patients is the CDC's pamphlet, What to Do If Sick. You can download that online. The CDC has a voluminous web presence with all things COVID, but just put in their search bar, What to Do If Sick. I love that guidance. It's real simple. You stay home, you hydrate, you rest. If you're feeling horribly, worse and worse, can barely get to the bathroom, barely get to the kitchen, you're so weak, you're so winded, then you need to be in an emergency room. Yeah.
All right, thank you.
Yep.
All right, Kurt, anything else before we open it up for questions?
Nope.
All right, thank you. All right. Morning.
Hello. Well, I'll start. It looks like some of the stats are beginning to turn.
Yeah.
Is it too early to say we're seeing a plateau of cases?
I think it is. Give us another week or two, but I agree. I think I don't have a graphical display for everybody to see, but if you could go to the dashboard from the State Board of Health, I think you'll see that maybe we're seeing a plateauing. Like last week, maybe the peak. That hospitalization curve for the state of Indiana on the dashboard is impressive. This surge is impressive with the disease burden. And as I mentioned, maybe that is just past its peak now, maybe. So, right, some optimism. I agree.
So do you have any takeaways from Kurt's fact that the symptomatic, asymptomatic have essentially flipped? What does that tell you?
Well, I think what we saw a year ago and what we are seeing this year was the start off of school in a paradigm that hasn't really changed in a year, where all of a sudden it's all about the testing again. And we had a lot of that queue, I think, at the fairgrounds with school-related issues. And unless you're masked, there's all this testing paradigm, testing framework that comes to play as a asymptomatic close contact. You can soften the days of quarantining with a negative test at a certain point in quarantining. In a fully masked environment, back to that governor's executive order, it reframes that, and a lot of that goes away. And I don't know for sure, but maybe what we heard from Mr. Carlson reflects Warsaw Community Schools' brave decision, their school board bravely deciding to follow that olive branch with quarantining from the State Department of Health, springing from that governor's executive order at the beginning of September. I have to think that that is a palpable end result of that administrative decision. It's a little too early to say, to be honest, but maybe. That certainly was one of the things I was after in pushing that, is that we would see a softening of these crazy queues for testing. So much of them being people with no symptoms. So more schools need to consider that framework. Take that olive branch. It really is much better for you. If this curve is softening, then this whole thing perhaps is headed toward the rearview mirror. And in 6 weeks, we'll feel more comfortable about all this, maybe. But the case burden is still very high. Transmission is very high. Hospitals, as Mr. Carlson has related from Dr. Weaver's comments, still seeing diversion in a big way across the state. We just can't quite back off yet. Yeah.
Speaking of testing, what about home tests?
Yeah. I wish I knew more as to how to exactly quote sensitivity and specificity, the amount of false negatives, false positives. I think it's a real tool. I mean, just anecdotally, my daughter with 3 little kids, she's a nurse, and needed to go to work, had a shift, and her kids had coughs, runny nose. They're little kids. And they used an at-home, they went and bought a 2-pack at a pharmacy and did in-home tests, and even went then to a doc's office, and which mirrored the negative in-home test. That helped with some decision-making in the home. They realized it wasn't a perfect test, but it was something they could go to the pharmacy in the evening and buy, and at least help their calculus at home. So I think they have a place. They do. If I was a parent, I think I'd maybe have a 2-pack sitting in the cabinet at home, just to help my thinking a little bit.
Yeah,
Help me triage.
Yeah, to the point of false negatives, I think as the state gathered more information about the rapid test as opposed to the deep nasal, I think they found that actually the rapid test is about as accurate
That's
as.
good.
So earlier
Yeah.
on, they were saying there were too many false negatives, and I think they've corrected that now as they actually looked at the data. So now they're considering them equally valid.
Another comment on home tests, and again, this was part of that State Department of Health information that came out. None of those tests are reported. And the suggestion by the State Department of Health is that if you are positive with a home test, they suggest that you go get a test at a testing site.
And then a variant, I think a couple of weeks ago I heard something about another variant coming like in or
Mu.
I can't remember what
Yeah,
it was.
there's Mu was getting some press, and I didn't bone up on that for this week's press conference. I did last week, and it looked like the concern for that was softening a bit. I think it just didn't seem to have the legs of durability in exploding in the population that Delta proved to demonstrate. Yeah, there was some early gnashing of teeth over that one. Yeah. Yeah, why certain variants, certain pathogens seem to be so ferocious but then don't seem to really have legs in the population is always fascinating with emerging pathogens. Some things just really explode, like SARS-CoV-2 in general has really been a durable issue. Some new pathogens they'll stir up some dust in a given small geographic region, and then it just seems to die. It doesn't seem to have the legs through the population in a broader sense. That's fascinating to me.
So testing will basically decide whether or not you're positive. How do they determine whether you're positive for a certain variant? Do they survey randomly?
Right. So that's back to the state lab, and the reference labs have an algorithm they work through with a certain percentage of samples go on to the genomic testing that helps you dissect out what the variant may be.
Got it. All right. Anyone else? All right. Well, maybe we're catching our breath this week a little bit.
Maybe a little bit, yeah.
That's good. It's still need to maintain them. Again, just want to mention we are staying orange, which is better than going red. I did look at the state map in our region up here. One county has gone red while the other one went back to orange. So we're kind of maintaining our neutrality, if you will, in the northeast part of the state. A number of counties that are red are pretty close to what they were last week. There may be one more if I counted them correctly. So maybe we're pausing a little bit here. Hopefully that pause means that maybe next week we'll have better news. But for the most part, I think this is still a very concerning situation. With the hospitalizations, the need to vaccinate. So let's see you back in a week, and we'll see where we are. All right, I appreciate Dr. Remington and Kirk Carlson and everyone from the health department, our fire territory, and their support of the vaccination clinics. We've been blessed with a collaborative community to try and get through this thing, and it's obviously gone a lot longer than we thought it would. But we need to keep our direction straight ahead and get vaccinated and get through this thing. So, all right, thank you all.
Thanks.
So mu would be the 11th variant if I